Two Australian-backed aid projects were left in limbo when the United States government cut USAID funding, slashing billions of dollars from outreach programs worldwide. Projections earlier this month by UCLA in California show that the cuts may lead to more than 14 million additional deaths globally by 2030, including more than 4.5 million children under the age of 5. Mudasser Siddiqui is the Deputy CEO from the humanitarian organisation Plan International and joins us now. Mudasser, welcome.
Thank you. Thank you for having me over here.
You're welcome. So can we start by looking at the impacts then of the cuts to USAID? Where are they being felt the most?
They are being felt all over the world. Here closer to our neighborhood in the Pacific, we see lots of programs that were being supported by USAID are being cut. There are programs in the Asia Pacific, in Indonesia, as you reported, earlier. One particular program where, DFAT was partnering with USAID has also been cut. And we are seeing these devastating cuts happening in other parts of the world, particularly in the hunger spots like Myanmar, South Sudan.
So the Trump administration cancelled 83% of its programs earlier this year. What's been the impact on your aid work of that?
Oh, it has been a massive impact for us because what we are seeing now in our program areas, particularly in places like Sudan and South Sudan, is that we are not being able to provide food and nutrition supplies to children and families to the level that we were able to do prior to these financial cuts. Our partners are, being forced to turn back families or to significantly cut down rations that we were able to give to families prior to this particular crisis. What we are seeing is the impact, particularly on children, is quite devastating. And there is a generation of children that is going to grow up with this crisis, which will be hungrier and less developed.
And is any aid money from the US getting through, Mudasser?
There are very little amounts of funding. As you earlier reported, about 83% of the funds have been cut. So whatever remaining is there is being channeled through some of the agencies, including through Plan International in some locations.
And are these impacts being felt across the aid sector?
Yes, they have been felt. And what we are seeing is that the whole global humanitarian architecture, the system, is now crumbling. There is a domino effect. Big UN organizations like World Food Programme, UNICEF have been impacted. And then there is a domino impact of that coming on to smaller aid agencies, local organizations, community-based organizations that were relying on this support to serve their communities.
And which are the cuts that concern you most? Which are the programs whose absence is particularly being felt?
Particular impact is really coming on the support for food, nutrition, and health in high impact locations such as Myanmar in our neighborhood, but also in places like Ethiopia, Sudan, and South Sudan. What this is resulting in is that children, particularly girls, are eating less, they are eating last, and families are now being forced to push their children into, uncomfortable and unfavorable behaviors. For example, girls are getting married or pushed into, child labor much faster. And this is an impact that we are seeing all over.
And what will the withdrawal of USAID money mean further down the track, Mudasser, if programs that battled AIDS, TB, other conditions aren't now happening and medical supplies are not getting to those who need them? What's going to be the longer term cost?
So the longer term cost is, as some of the medical journals have predicted, we are looking at about 15 million deaths over the next few years. What we are also looking at is a world which is going to be less prepared for future pandemics. We are looking at a world which is on one side experiencing severe climate disasters, but is going to be less and less prepared to help the communities be resilient to those disasters. So overall, we are going to continue to see increase in humanitarian needs and more suffering for generations to come.
Finally, if USAID money were to start flowing again, how easy would it be to reinstate those programs, to get those programs back on track?
What we have lost with these cuts is the years of investment, partnerships, research, and collaboration that communities and organizations had built over the years. Uh, while the money, if it comes back immediately, it will be very helpful. But there has been a lot that has been lost, and it will take time for it to be rebuilt. It's easier to destroy things, but to build them, it takes ages. And I think that will be the same case here. However, there are already existing institutions, local organizations on the ground that are there. And if they were to be provided resources, I'm sure that we will be able to recover much faster.
Mudasser Siddiqui, thank you so much for your time.
Thank you so much for having me here.